Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Innovative Approaches to Applied and Experiential Learning for Undergraduates. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by the first presentation and a short question and answer period, and then the second presentation and ending with a question and answer period. This webinar is part of the 2017 ASPPH Presents monthly webinar series. This webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CBH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of each presentation. We are pleased to have with us today our speakers, Miryha Runnerstrom, Janet DiVincenzo, and Jessica Evert. Tricia Todd is unable to join us today, unfortunately. Miryha Runnerstrom is an assistant teaching professor in the program of public health at the University of California, Irvine. She teaches courses on writing for public health, environmental quality and health, health and global environmental change, and public health and wellness. She also teaches the Public Health Honors Thesis course series. Her research interests include behavioral and environmental influences on health and well-being, as well as how rapid global environmental changes are affecting the health of the world's populations. Janet DiVincenzo is an assistant director for online learning at the University of California, Irvine. In this capacity, she collaborates with campus faculty to design their classes for online delivery. She also serves as a consultant for instructors and staff on pedagogy, technology, and best practices related to online and hybrid education. Dr. Jessica Evert straddles international education and the medical profession. She served as the medical director for Child Family Health International from 2008 to 2013 when she was appointed to the executive director role. Dr. Evert is faculty in the Department of Family and Community Medicine at the University of California, San Francisco, where she instructs in global health and community-based underserved care and helped develop as well as completed the Global Health Clinical Scholars Residency track. Dr. Evert is a graduate of the Ohio State University College of Medicine and is a longtime advocate for health-related international education quality and ethical standards. And Tricia Todd, who is unable to join us today, is an assistant director with the Health Career Center at the University of Minnesota and an instructor in the School of Public Health. She was responsible for the administrative oversight of many of the activities of the center and the creation of new educational programming. Tricia is the lead designer for the Global Ambassadors for Patient Safety Online educational module and has developed multiple global experiences for students. Thank you for being here today, Miryha, Janet, and Jessica. And I'm going to turn it over to our first presenters, Janet and Miryha.
All right, thank you, Sarah. Good morning, everyone. Today we're going to be talking to you a little bit about our experience developing an immersive online course that involved role-playing, case studies, and group work, and how we reconceptualized an existing course in order to achieve those goals. Let's see here. So when students, well, first I'd like to welcome you to our course. This is what students saw when they joined our online course Canvas space. And this was an image map where students could very easily click on different course content, including accessing materials from the different weeks or the syllabus, for example. Our course, Environmental Quality and Health, was a summer course, so we had in just 5 weeks to accomplish everything that we can normally accomplish on the 10-week quarter system. This was the first time that I had ever taught an online course of any kind, and it was the first time been transitioned into an online setting. So I was really excited to work with Janet on this project. So for our course, we wanted to kind of reach this sweet spot where we could immerse students through a case study that involved role-playing and also small group work. And this was something that we knew would involve quite a lot of choreography to make sure the students stayed on track. We felt like in a 5-week course where everything is happening at double the speed, they had no time to lose, so we couldn't afford for them to become confused at any time during the quarter or get lost. And we'll tell you a little bit more about how we manage that choreography using this case study approach. So this is just a makeup of the 57 students that were enrolled in the course. You can see there's a somewhat even distribution, not as many freshmen and slightly more seniors, but it was relatively balanced. So we knew we had students who had already taken some upper division courses, possibly even courses on environmental quality and health already. So we wanted to be sure to engage them while also not leaving behind students who were perhaps earlier in their studies and not public health or health science majors. The students came from a variety of disciplines on campus. This is a Category 2 general education course, and so students from all across campus can take that for general education credit in the science and technology category. There were, students in the other category were a combination of business students, education, physical sciences, computer sciences, and even students from the School of Arts. So we did have some students with a science background, but not all of them.
So this is Janet, and I had the pleasure of working with Miryha on this course. And one of the things that she said to me early on was she didn't want a canned online class. And it isn't something that I often hear from faculty. So I knew that I was really in for a ride with her. And I think the fact that she was so open to stepping outside her comfort zone and of course my comfort zone really afforded us the ability to explore some innovative ways of engaging students. And this involved a fair bit of risk on her part, certainly, because she'd never taught an online class before. So it's not uncommon when I'm working with faculty for the first time. They kind of want to play it safe. They don't want to do anything too risky or too too outside the mainstream, if you will, but that was not the case here, as you will soon see. Oops, went too far. So what you're looking at here is the whiteboard that sits in Miryha's office, and the reason we included it here is because it really ended up being our blueprint for the course. And somehow we banged this out in the course of an afternoon or morning. The amazing thing in the end was that we pretty much stuck to it. And I think that it, is really a testament to some, really deep thinking that we did early on about how we wanted to build the class. And one thing that I really appreciated about Miryha is that she was always had in top of mind what the students were going to be going through in any given week. So in week 2, you see it says confusion, right? And so that, inspired us to think, okay, how can we allay that confusion? We need to clarify things. We need to make sure that there's no false starts, because in 5 weeks you just don't have time to recover from that. And so throughout the 5 and then 6 week being the finals week, we try to really pinpoint what are the key points, what are students going to be going through in their heads, and what do we need to produce in association with those sort of common characteristics.
Yeah, and what I really love about this is that it was a format that we were able to use as basically the scaffolding to lay on top of it what ended up being our case study, and it fit really naturally. We didn't know it would at the time, but that ended up being the case, and I really love this. We didn't erase the whiteboard for the entire summer in case we needed to go back to anything, but I wish it was still there now.
Sometimes low technology does the job.
That's right. So speaking of that case study, part of what I spent a good deal of time doing in preparation for this course was seeking out a case study. At first, we thought maybe we could write our own case study that had to do with some major global environmental change that has been occurring and what the impacts of that would be on local populations, global populations, and so on. But I also had spent quite a bit of time scouring through the National Center for Case Study Teaching in Science, which is a resource that's available to all of us. And what I particularly liked about this case study from Phil Camel is that it started with an argument between a logger and a farmer, and this really engaged me because I knew I wanted students working in groups, and I knew I wanted them to somehow embody a role. And so here was a case study that already had, in fact, 3 characters included in the write-up. And I thought, you know, even though this is a little bit old, I think it had been written maybe about 10 years ago, we can update this and we can make this work for us. So we added 2 more characters, a policy analyst and someone with a public health perspective, and that formed the basis for our 5-person team in the course. And so I think it really worked well. And I would encourage you, if you're thinking about developing a course with a case study and you want it to be this immersive, to look for existing case studies. That really was a tremendous asset for us. We did need permission to use this, and we had to have permission to just break it down into individual parts, but that was very easily obtained. And they wanted to know if we were going to post it online publicly. That was easy for us to assure them that only students in the course would have access to that. And another thing that I think a lesson that we learned is we were originally attempted to maybe try more than 1 case study, and I'm glad we didn't do that, because that would have been too much overhead to switch the students from, you know, 1 case study's thinking to another and reassign them to teams or roles. So instead we looked for a study that had depth and nuance, and also one that didn't have one obvious right solution. So when we're talking about the issue of deforestation in the Amazonian rainforest, this gets to sort of these wicked problems that we face at the boundary of conservation and climate change and politics and local pressures. So it was a very interesting case. And something to note is we didn't reveal the entire story to the students up front. We gave them little pieces each week as we wanted them to learn more about this, this particular problem. So again, it was very immersive. And it bridged the gap between theory and practice that we were often talking about in the course. But the main challenge that we faced was finding just the right case study. And actually, we weren't convinced that we'd found it even when we decided to use it. We really thought we have to try this and see how it goes. And it worked well. We'll be using it again this summer with the course. We did, as I mentioned, we unveiled little bits and pieces, and Janet used both Storyline and VideoScribe to create some of the content, and it was very immersive for the students to view it in this interactive video platform. So we mentioned that we had students working in small groups of 5, and they met every week via video cam. Through the course website, there was an option for conferencing. So we enabled that, assigned students to groups, so they had a private conferencing space. And this is functioned much like a required lab session. It just occurred online. So this was, I think, a very useful tool to use. It first engaged us with one another, so it wasn't just an anonymous online course where students are known by an avatar or a name in a discussion post. They actually got to know one another. And I thought that was great. We also kind of tricked them into collaboratively learning together and learning to work across teams, because we asked them to stay in character and stay in their roles throughout their discussions, which certainly was a challenge for many of the students, but they did try. And so there was a lot of critical thinking about these important problems. There was a lot of teamwork and problem solving. And so that was different than what I had assumed an online course would be, and I was really delighted with that outcome and impressed that the students gave it a try. It was a big risk that we took. Of course, it wasn't without problems. There was always the issue of laggards and slackers. And so one of the things that I had to do was kind of check in on them. I would pop into the sessions about 10 minutes after they'd started and just ask if anyone had any questions, if they needed any clarification. And also this was my way of checking that everyone was present and accounted for. And if they weren't, I sent them an email immediately, and more often than not, they would magically appear. So, you know, there was sort of an accountability issue, but students were very accountable for their own groups, and there was a lot of peer pressure for people to stay engaged, and I was was impressed with that as well. So I didn't have to police as much as I thought I might have to. And what shows on the slide now is the agenda that we created just for week 1, but every week had an agenda where we would give them some outcomes that we wanted them to produce. And, you know, I think in the future, one of the learns that we had was that we thought it would take them this synchronous session plus perhaps an extra hour to accomplish the tasks that we had for them related to the assignment. But in reality, they can hammer it out in just the one session synchronously together. So we need to add a little nuance there so that it does take them a little bit more time. And also in the future, if students miss a session, we're going to ask them to complete an additional assignment. Just to make sure everyone is very incentivized to attend those sessions.
So here you're seeing the 5 characters, and I used an e-learning development tool called Storyline, which is a very common tool that instructional designers use. And it comes with these sort of stock characters that just for ease of use, I mean, I could have sourced or had someone create them, but for ease of use, we just use these stock characters. What we do is we ask, the students are assigned a character just to make things, you know, expedited and quick. We didn't want them spending days figuring out who they wanted to be. So they were assigned a character, and then they were asked to kind of get to know their character and really wrap their minds around the drivers and motivations of the characters. So this immersive idea is really, from a pedagogical standpoint, to get students to try on a different lens and consider alternatives, right? Stepping outside their own worldview. And, you know, so you had one character, the environmentalist, who was all save the trees, and then you have the farmer going, I need to feed my family. So these were the sorts of, you know, dialogues that we'd hope students would engage in. And, you know, they had the weekly online sessions for them to kind of, you know, have a safe space in which to disagree and you know, hash through some of the issues. So what we did discover is that it can be awkward for students to stay in character. And I think that is just rather a kind of a normal expectation that we might have. But again, you know, we did try to make a safe space for them. Another challenge that we discovered is when the group changes size due to students dropping the course or students adding the course, and we had to fill out a 4-person group to make 5, you know, it can get tricky to administer, and then they have to kind of come up to speed. So, but those are just kind of administrative things. So here you're going to kind of quickly see some of the sketches that we wrote together, Miryha and I, of the 5 different characters. I know that probably went pretty fast, but we don't have all the time in the world today. And then what you're seeing here on this page with Rachel being front and center here is what we called a bio sketch. And the very first week, I believe, we asked students to fill this out for their own character. So we did one of these for every character. And, you know, we asked them to think about, okay, you know, put yourself in their shoes. How do you see the world? And what has influenced your perspective? And then on the right-hand side here, we asked some fun questions. You know, would Rachel purchase bottled water? Well, of course not. And, you know, would she buy carbon offsets for her plane flight? Well, yes, of course. And so on. Just to kind of keep it playful and, but also, you know, educational at the same time. So, again, you know, the previous screens that flew by a little quickly, and then this, they all really constitute more of that scaffolding that Miryha alluded to earlier, which is, making sure that students have just enough information that they can then, launch from, because there simply isn't time in a 5-week class for students to get, overly confused or bogged down. We wanted to keep the pace moving, and doing these sorts of things was sort of our thoughts about how to do that.
Well, the 5 weeks flew by in no time, and it wasn't long before we were reviewing the feedback from the students to try to determine what this experience had been like for them. I'll say before we do that what it was like for me was pretty incredible. I was actually very engaged in this class. I spent most of my mornings checking in with students, seeing how things were going, reviewing their assignments. I did have a teaching assistant for the course, and we were in constant communication throughout. And so for me, it was very enjoyable. There was a lot of upfront effort, and once the course was running, it felt much like my normal lecture courses where I would still be checking in with my students and interacting with them. So I really enjoyed it. It was a much better experience than I had anticipated. And the students seemed to like it as well for the most part. They made comments about the quality of the course being the best that they'd seen in terms of online courses. Despite it being challenging and having some slackers on their team. So that's obviously a challenge that we'll work on for this upcoming session when we offer it. And I think role-playing was very novel to them, so those comments kind of came through, and that the course was engaging and not like anything else that they had taken. So that we achieved our goal. That's what we had set out to do, and at the end of the 5 weeks, that's how it had been. Janet, do you have anything you wanted to add to that?
No, I think that's a good summary. It was completely enjoyable for me, and probably represents one of the high points of my instructional design experience here at UC Irvine.
So with that, we'd like to open it up for questions if there are any.
Great. Thank you so much, Miryha and Janet. I'm going to remind everyone that they can submit questions throughout the presentation by submitting them through the question box. And we do have a few to take right now. The first question, my Center for Online Development discourages use of synchronous group work since students have very different schedules. Was this an issue for you in terms of some students not being able to attend all the group meetings?
Okay, yeah, that's a very good point. One of the things that we asked them to do when they enrolled for the course was they had to pick a discussion section, and we had a frequently asked questions page that actually indicated to them right then and there that they would have to attend. We did offer intentionally evening sessions, and we did this for a few reasons. We knew that students would be all over the world because many of our students go home to their native countries during the summer. So we had students from all over the world, which was wonderful. And that made it so in some time zone or another, you were awake. And also it allowed students that were here on the ground to have jobs, and many of them do work. So, 8 o'clock, I think we had a discussion at 7, and at 8 o'clock we had some in the afternoon and some in the morning. And generally the evening discussions were the most packed. So we were able to accommodate. When people weren't attending, I would try to get to the bottom of why. And, for a lot of people, they were actually on a vacation, not, it wasn't work related or schedule related. So that created an issue for their groups. And very often they were just removed from their groups and didn't succeed in the course.
Thank you. This person asked what percentage of the mark was assigned to the group work?
That was nearly 100%. We started the course with individual assignment where they would work on the bio sketch by themselves, and we had the discussion post that they were asked discussion questions about the case each week, and those were individually graded. But I think it was about, maybe at the end, about half of the points were for this group assignment. And the final assignment in the class was in fact a group assignment where they, as told us what some solutions to the problem of rainforest deforestation might be and what plans they had for the future. So part of that was an individual assessment, but a lot of it was group, probably about half.
Great, thank you. Are you willing to share your syllabus for this course?
Oh, sure. Yeah,
Great.
yeah.
Maybe you could send that to me and I could send it along to the person. That'd be great. Yeah, you noted that these students came from across the university. How did you promote or advertise this course to the students?
That's a great question. We did not do any advertising. So this is a course that is already known for its on-the-ground component. I usually offer it in the winter quarters on the ground, so students are kind of aware of it, and many students take it because they're interested in health. So we have a blend of students in that, and so I didn't offer it in the winter quarter this year, but we had sort of started informally spreading the word about it. To public health students, the advising group was letting people know, but otherwise there was no advertising at all, so we got lucky.
Oh, that's great. And you also noted that the course was interdisciplinary in nature just because due to the students' different backgrounds. Do you have any takeaways or notice anything about their discussions that maybe is different than what it would be in a traditional public health course?
I did notice there were differences in the way that they would approach problems. So we had some students, especially there was one student I remember who had an economics background, and they were framing a lot of the discussion in terms of economics. And they had been assigned to, I can't remember if it was the logger or the farmer, but both had a very economic-based approach to this issue. And so I think it went hand in hand, and we saw that where the health students who may have been assigned to someone who was more like a conservation biologist would be looking more at health-based issues. And so I felt that worked well. When the groups were high functioning, they were able to kind of fill their group members in on how they would approach the problem from their own major perspective, and I really appreciated that.
Sounds really interesting. And then one other question, what would you do differently the next time you teach this course?
Oh yeah, great question. Well, Janet and I have spent quite a bit of time talking about that, and I'm sure she has some thoughts to add. One of the things is we definitely need to change the sequencing. We had given a lot of thought to how they were going to kind of dance through each week, and we gave them this choreography, and then it turns out that they didn't look at that at all or didn't follow it. They still accomplished everything they wanted, but they found a logical sequence that worked for them, which flipped two of the steps in our mind. So we're going to revamp that for this time around, and probably they'll flip it again and we won't know what's going on, but that's just students are always innovating. So that was something that surprised us because we had given so much thought to the student experience and what they would want to know next. So definitely we're going to change that. And we are going to resequence some of the initial assignments because of the add drop period here. They have, I believe, 1 full week to add or drop the course. And so I want to push back some of the assignments so that we're not struggling to get people into groups when the groups are still changing in size. That was really something that was extremely laborious for myself and the teaching assistant. And it created just too much chaos at the beginning of the course for us. I don't think the students noticed that, but we were really struggling there. And Janet, I'm sure you have some thoughts about that.
I would love to, if time were permitted, what I would love to do, maybe not for this summer because it's coming up fast, but for the future is add some more interactive modules. Because of time constraints today, I can't take you into the interactive modules so that you can see them. If you're really interested in that, you could follow up with us and I'd be happy to show you them. But I think that's what I would do is just continue to build on those very graphic, intense multimedia e-learning modules, I guess you could say. But that's probably a pipe dream, but from where I sit, that would be a fun thing to add.
Great. Very interesting. I guess we'll take one more quick question. How many students did you enroll, and is there a maximum number of students you would suggest?
Oh, that's a great question. We started with a cap of 50, and then we extended it to 70, and it did fill, and then it went back down to 57. We have a lot of students shopping for courses, and so and they can't gain access to the course material until they enroll, so that obviously impacted it. I think 57 was a really good number for an initial run for something that was so unusual, both for the students and for me. I mean, it was my first online course, and then we took this kind of radical approach to designing it. And so I think cozier is better. It was also easier for me to check in with all the groups because there were only about 12 groups. So that certainly made my life a lot easier. This year we're hoping to have maybe 20 more students than that, and we'll just keep ramping it up as we work out the bugs.
Great. Well, thanks so much, Janet and Miryha. I would encourage everyone to continue to submit questions throughout the presentation, and we will address any other questions at the end of the next presentation. Jessica, I'm going to turn it over to you.
Hi, everybody. Thank you for joining us, and thank you to the co-presenters and to ASPPH and Sarah especially. I'm really glad to be here. And I'm representing both myself and my esteemed colleague, Tricia Todd, who's at University of Minnesota Health Career Center. So I will be bringing her content into this presentation as well. We're going to zoom out a little bit about ethics, safety, and some of the power dynamics that underlie experiential learning for undergraduate public health students. Just to touch a little bit on my positionality, so I'm a family physician, as you mentioned in the introduction, and I'm also Executive Director of Child Family Health International, which is a nonprofit organization that works with undergraduate, graduate, and postgraduate institutions to health practicum, experiential learning, service internships, and elective opportunities. And I'm going to speak specifically about our programs, but you can learn more at the website if you're interested in that. One of the important things to recognize about Health International is our tagline, which is "Let the world change you." And I think that's an important underpinning and challenge to some of the traditional assumptions around global health engagement. I want to start off by presenting this email that I received from a student, an undergraduate student, several years back. He wrote to me and said, "I am trying to establish a long-term and impactful relationship between my school student body and the villages and small towns of South Africa. My school students, who have a reputation for being extremely medically driven, will be very interested in serving communities medically, whether it is through patient advocacy, disease illness awareness, or being able to directly participate in minor surgeries and procedures." And I bring this email to your attention because this is pretty typical for undergraduate students who are pursuing public health or global health learning opportunities. There's an increasing number of undergraduate public health programs as well as undergraduate majors and minors in global health, and sometimes those are overlapping. And many of the students who pursue the undergraduate degrees in public health or global health are pre-health in the way that they are wanting to pursue graduate education either in clinical health professions or further public health or global health training. Many of them also have this desire to use international opportunities to do things that many of us would consider perhaps within the acceptable range, such as advocacy or raising awareness, and then things such as this student highlights, which I am highlighting in red at the bottom, being able to directly participate in minor surgeries and procedures. So there's a growing tension between kind of what's appropriate for undergraduates who are pursuing public health or global health training and what's inappropriate and needs to be steered away from. So I'm going to be speaking today about some tools and resources you can use on your campuses to try to orient students as well as faculty members and your institutions to kind of the best practices in this realm. So this is where we sit. I'm a big fan of Venn diagrams. So we have many challenges and opportunities in undergraduate public and global health training. When it comes to the experiential component, oftentimes we are in this nexus between low resource settings, many of which are international or considered developing countries or low and middle income countries, but also maybe low resource settings in our own backyards or domestically. And then health-related settings, and the caveat here, I think, is that public health, meaning non-clinical population-based health, and individual clinical practice are often not as well separated internationally as they are domestically, meaning that a site that is a public health site may be providing both population-based health as well as clinical care. And so when we're placing students in health-related sites where clinical care is happening alongside public health, the students can be sucked into clinical activities inadvertently. And then the third piece of this Venn diagram is our practicum or experiential learning requirements, which often come along with coursework or degrees in public health or global health. So this nexus provides a variety of challenges as well as opportunities, and what's going to follow is a discussion on how to maximize the opportunities and the benefits and avoid or address some of the challenges. So just to put a point on this, these international programs or global health or public health experiential learning opportunities can come under a variety of different names and terms. So, and they may live on different places on campus. And so I bring this out because traditionally in pedagogies there are different types of engagement that focus more on learner development or on community development. But what happens in the international global health realm is that the same type of programming can be labeled very differently based on where it's housed in the university or the organizations that you're collaborating with. So terms that you may recognize include service learning, community outreach, co-op, internship, volunteerism, and practicum. Regardless of the term that's used, when done inappropriately, it leads to things such as this. This is an Instagram post from last summer, and it's a student in Vietnam, and her caption is, "Suturing up a head laceration on one of the Vietnamese locals, hashtag volunteer surgeon, hashtag I don't know what I'm doing." And this was an undergraduate student. These Instagram and social media posts, unfortunately, are not a rarity. We have documented that there are thousands of students going abroad at undergraduate levels and doing hands-on clinical care. This is an article that came out in The Advisor, which is the journal of pre-health advisors, and it catalogs a variety of case studies, actual encounters where patients were harmed by undergraduate students. Similarly, Noelle Sullivan, a researcher at Northwestern, this past week came out with a Scientific American blog that was chronicling her research showing undergraduate students pulling on breech babies, which can suffocate the baby, as well as cutting unnecessary episiotomies on labor wards. And so because these students are going abroad under the auspices of degrees in public health, global health, or other social sciences or basic sciences, it's an issue that we're all addressing. Judith Lasker wrote this book hoping to help, elucidating both the opportunities and the pitfalls of global health volunteering. So when we look at it from an academic framework at like what are our goals as far as learner development in the realm of global health and public health, this is a graphic that came out of Canada that I find helpful, in part because the petals around the global health expert being the goal include roles such as communicator, collaborator, manager, advocate, scholar, and professional. And then those boxes around the edges have different curriculum delivery mechanisms such as problem-based learning, e-learning, mentorship, service learning practice, and transformative, informative evaluation. What I think is probably something that we all believe in and feel passionate about are the values and principles on that outside rung, things like health equity, social justice, solidarity, responsiveness, respect, honesty, humility, and sustainability. Unfortunately, despite all of our well-intended values and principles, when learning opportunities are operationalized, they often can take a different form that none of us intend them to have. And so I'm going to talk about some of the tools that we have to avoid that or to course correct. One of the first tools is standards. So there's a variety of standards in this area that you can draw on at your institution with students or fellow faculty to talk about what is appropriate or inappropriate. this is the Forum on Education Abroad standards. So the Forum on Education Abroad is the Department of Justice appointed organization to set standards in the United States on education abroad. And these are their guidelines for undergraduates in health-related programs abroad. So this applies to public health, global health, and other health-related programs. These are open access online, and I will send out resources afterward, after the webinar, so you have a copy of those. We also have the weight standards, which tend to speak more towards graduate and health professionals training, but I do want to point them out. The Forum on Education Abroad standards were heavily informed by these that came out in 2010. This is Gonzalo Duarte's standards, and he's with Compañeros, an organization in Nicaragua. And these were formulated for global service learning programs, but apply, I think, very broadly to international practicums. And so things like organizational alignment, sustainable management, responsible marketing. And I think the responsible marketing one is really interesting because many students will find their own opportunities either through the internet or student organizations. And as professionals, when we look at the marketing and the language used and what students are being told they're going to be doing or what their impacts are going to be, without really supporting it with data or evidence or research to that effect, we can start to see that there is a lot of concern for irresponsible marketing and for students being kind of sold an inflated sense of impacts, which then leads the student to, I think, feel pressure to have those impacts, even though their training may limit them in some ways, particularly in technical fields. Duarte also talks about implementation and co-education and co-creation, as well as environmental and planetary responsibility and realistic evaluation. And so many organizations and entities are not putting resources into evaluation, which makes claims difficult to substantiate with regard to impact on learner or community. Fair trade learning is another concept that I wanted you to be aware of. This comes out of kind of the undergraduate global service learning field. GlobalSL.org is a leader in this area and has a lot of information on fair trade learning. I will send that link out to you. But the idea around fair trade learning is that when we send learners into lower resource settings, whether domestically or internationally, they can be a strain on resources, both material resources as well as intellectual resources and time. And so as institutions who are facilitating, requiring, or encouraging these experiential learning opportunities, we have a responsibility to recognize the costs that students have and making sure that we're remunerating those costs in a way that's fair and ensuring that we are not further draining resources, or if we are, that we are making up for that in real, tangible ways. The next resource that I want to point out to you is that of competencies. The ASPPH is currently redoing their competencies in global health and are working closely with the Consortium of Universities for Global Health, where I have the honor to chair the competencies subcommittee. And this paper came out in 2015. It's open access in Annals of Global Health, and this was a multidisciplinary effort to try and describe what are interprofessional global health competencies. Interprofessional meaning both when professionals are working between disciplines, but also competencies that can apply regardless of what professional pursuit the students are having. This was an iterative kind of peer review process that went through over 24 competency sets, including those coming from public health, and basically created a consensus model. These are the domains which look very similar to those from the ASPPH with regard to competency. This paper outlined two levels of competency. One is the global citizen level, which is kind of the first level of proficiency of any student interested in global health. And then the basic operational programs level, which is the third tier of proficiency, particularly for those focused on program management. And it went through the 11 domains and described competencies that are essential for both the global citizen level as well as the more graduated basic operational level. And as you know, competencies are broken down into knowledge, skills, and attitudes, and so this chart or this table also does that. To go further, because many of the competency sets that was used in this are actually competencies that stem from the Global North or organizations that are dominated by Global North faculty or personnel. This study was done by a subset of people. I was the PI on the study, looking at host community perspectives of the competencies that were outlined by CGH. Some of the results from this study include partners saying that it is very important for students to recognize their limitations in the realm of technical skills, students needing to work well within the team setting and maintain respect for other team members and other disciplines, and that there's a huge role for learning about culture. And we kind of created a dichotomy between technical skills and cultural or contextual learning. And contextual cultural learning won out as being more important than learning clinical skills or technical skills. And to challenge the notion that students are acting as extenders of the healthcare system and as independent professionals, we asked if there's an expectation that students will be able to work independently or care for patients without supervision, and that was found to be not important in a statistically significant way. With regard to follow-up and the number of students, with regard to partners, 48% said they wanted more students, 52% said that the current number of students was fine, and 0% wanted less. 0% said students come as practitioners ready to work. So this challenges some of the organizations that are framing these experiences as students being practitioners. 90% said they wish students would stay in touch more after their experience abroad, and less than 25% of students do stay in touch. Some of the qualitative data, which is still being analyzed, some of the biggest mistakes that were cited was, quote, students must abstain from expectation and over-criticism. They must have a compassionate approach as the host and the team put lots of effort in establishing the program. Students that do not respect the environment and culture do not come out of their comfort zone, do not follow discipline and dress code. Students tend to over-expect from the program sometimes, as they want hands-on experience which cannot be provided very extensively, keeping with local government administrative protocols in place. And students attempting to do too much and not able to achieve goals. Qualitative data addressing the question, what should students remember when they go home? Hosts reported, quote, our culture and our dedication to make their time memorable. Quote, the knowledge they gained here in the Indian hospitality. During the program, some of them discover their potential, and they should always believe in that potential. Quote, that being a good doctor, you need to be a good listener. You must listen to your patients very well. And quote, that you can change the life of a person who is different if they are aware and respectful of that difference. So some additional tools and resources I want to wrap up with include the concept of critical reflection. So I'm sure many of you are already using critical reflection, and my colleagues who presented first discussed that. This is a really important pedagogy for us to integrate into any global health and public health undergraduate studies. So this is from Open University, but basically just pointing out the reflection is not linear, that it's kind of a iterative, circular, nebulous process that does progress learners through increasing their self-awareness and critically analyzing the situations they're encountering, but that it's not always linear or step-by-step. It also helps to problematize dilemmas and issues, and help students look at situations from a variety of perspectives. There's a variety of frameworks for reflection and critical reflection. Wall's framework is one that I like because it's fairly simple. So the way that this is structured is basically asking students to discuss or document the what, so what happened, the so what, why it was important or impressive to them, and the now what, how this experience will inform their actions or behaviors or understanding going forward. And that now what piece is really what differentiates reflection from critical reflection. Critical reflection is encouraging the learner to discuss or ponder how things will, how the situation they're reflecting on will impact them going forward or change their behaviors. I also want to point out the work that Tricia Todd at University of Minnesota and her colleagues at the International Center there are doing, which is the Global Ambassadors for Patient Safety modules and faculty toolkit. This is open access, and it takes students through 8 modules, everything from picking an international opportunity through the logistics, and it culminates in the oath to be a Global Ambassador of Patient Safety. You know, I've been told that I can talk about ethics till I'm blue in the face, but if students think these things are going to help them get into med school or other professional schools, or think that they are doing something that should be celebrated, they're going to continue doing it. And Tricia and her team have really taken the lens of ethics and changed it to be in the language of patient safety. And patient safety is something that students often are more interested in than talking about gray areas of ethics. So this is a great tool, and it comes in 12 languages. Because the other thing we've realized is that we have to not only teach students how to say no thank you when they're asked to do things they're not equipped to do, but also help students have tools to blame someone else for why they're saying no, because it can be a very morally distressing situation whether they say yes or no. And so this oath allows them to say, you know, I'd love to help you deliver this baby, but my school has made me sign this that I can't do those kind of things because I'm not trained in that. So really being able to give students an out. And then just briefly, I just want to touch on the impacts. We don't have a lot of time to go into this, but just that this is a paper we recently published studying the impact of a program that students were involved in Mexico with the Ministry of Public Health training traditional birth attendants. And just to point out that if we're going to claim community impacts, it's really important that we do the research to support those claims. When we've looked, this is research done with Child Family Health International, independent researcher looking at the impacts of students on host and partner communities, and no communities reported increased community health as a result of the students, but actually reported improved English proficiency, increased prestige of host institutions, as well as local community members feeling like the students are a vehicle for them to realize their own global citizenship. To capture that, I just want to end on a quote by a CFHI medical director in India. He said, as a global citizen of the world, if I'm able to educate a student from any other nation, and he feels a little softer about places that are not as economically well off, then from that perspective, of course, is beneficial, because we are benefiting some students living in affluent nations to have a balanced view of life. So on that note, I just want to share Tricia and my emails. Please don't hesitate to reach out to us if you have questions, and we will be sending resources out after the webinar. Thank you for your time.
Jessica, thank you so much. That was very informative. If anyone want to remind everyone that you can submit your questions via the question box, and we will address them at this time for any of our speakers. Looks like the first question, I guess is for Jessica. With thousands going abroad, what recommendations do you have for finding and using appropriate or reputable global experience providers?
Mm-hmm. That's a great question, and thank you for asking it. I would really say that Duarte's tool, and I also have one online called Choosing an Elective, which is more towards clinical professional students. But there are proxies for that poorly designed programming. And some of the proxies I'll just point out that you can see on people's websites often. Number one is how are they depicting the partner community? Is the photography done in a way where they are taking pictures of patients or people in sensitive situations or reinforcing stereotypes? Another is the the accuracy of the marketing. So if you're reading on the website that they're telling students that in a week or 2 or 4 weeks, etc., they're going to go to this remote village and save the village or do X, Y, or Z thing, but there's really no data to support that, or they're taking students whose skill set would not be aligned with those outcomes, that's another red flag. If they're selling a bag of goods that they're going to see high numbers of people in a very quick period of time, so hundreds of patients lining up for a pop-up clinic, that's a red flag, because oftentimes when they're seeing really high volumes of patients, particularly involving undergraduate or even any level of students, unfortunately too often students are doing things like histories and physicals and triage that they are not completely trained in doing, and oftentimes in broken versions of the local language, if at all in the local language. So those kind of things are red flags. There are also there are people who have the naughty and the nice list, and because I have a conflict of interest with this, running an organization, I don't comment on specific organizations, but Tricia is happy to do that. And she's kind of a neutral party, so you can email her and she will talk to you about particular organizations.
Wonderful, thank you. That's really helpful. The next question asks about the global health competencies. When do you expect the next version to be available, and do you expect there to be substantial changes from the prior version or from the current version?
Yeah, so Sarah, I don't know if you have a timeline from the ASPPH work in this area. I know they are revamping and taking in a lot of perspectives, both within public health and outside of public health. So I expect that will be forthcoming in this coming year. The CUGH ones, they define 2 of 5 levels of competency, so there's still a lot of room for other levels to be defined, as well as refinement of the current levels. So if you're interested in competencies in a specific area, please reach out and I can try and connect you. CUGH also has a working group in this area, and then I'm sure ASPPH is happy to connect people with the right folks for the revamping of those competencies.
Yes, thank you. We are certainly agreeable to that, and definitely want to help people find the right resources and get people involved who are interested as well, so thank you. The next question asks, is there a typical length of time that students have on a global service learning experience?
There's some research in international education that suggests that 4 weeks is kind of a sweet spot because of the time it takes, 4 weeks in country, because of the time it takes to kind of assimilate and get over the initial culture shock and then assimilate and then the exit period. However, given schedules, it depends on the students' schedules, and there's 1 week spring break things happening, and again, I think the devil or the benefits in the details, and so you have to get beyond like, I went here and did this, and it's like, how long, what did you do, how did you evaluate it, like really asking about details that any of us would ask when we're thinking about a development or an educational project. But there is data that 4 weeks is a minimum. However, there are many programs that are much shorter than that.
Great, thank you so much. Looks like we have time for maybe one more question. This looks like it's directed toward Miryha. Did this course take more time to teach than your typical in-class course? And I'm thinking of the time required to monitor the discussion specifically.
Oh, that's a great question. Thank you for that question. Actually, I don't think it did take more time than my in the classroom courses, where I also have discussion forums where students can post questions. I feel like the time was shifted, and what I mean by that is we had to have the entire course ready to go so that when we launched it, all the assets were available. Every quiz was written, every rubric was finished, all of Janet's digital assets walking students through the case were finished, and everything was available to the students. Of course, we went through it week by week, but for me, I always spend a lot of time on my courses, so I didn't notice much of a difference there, but Janet might have a slightly different perspective on that to share. Oh,
sorry, Jen. No, go ahead.
No audio.
Sorry, Janet, we can't hear you. And I hate to cut you off, but in in order to respect the time of everyone, I want to thank all of our speakers for joining us today. And thank you for your thoughtfulness in putting together presentations and also the answers to all the questions that were put forth. I want to remind everyone that this session has been recorded and will be available on the ASPPH website in the very near future. We will be following up with all registrants regarding the posting of this webinar as well as the resources mentioned by our speakers. And there are several other webinars in the near future. Please visit the ASPPH website to learn more or to register for any of these upcoming webinars. And lastly, we do have an undergraduate faculty development workshop coming up on Monday, June 5th. It'll be here in Washington, D.C. at the ASPPH headquarters, and registration is limited to the first 24 registrants. So please, we encourage you to register and visit the event page for more information. Thanks again to all of our speakers and all of our attendees. Have a wonderful rest of your day and a wonderful weekend.
Thank you. Bye-bye.
Bye.